last 5 years working down here has really been horrendous. Though we've done what we can to reduce the number of people dying from overdoses, the numbers say that we haven't done enough. It just makes no sense to walk by somebody knowing they're going to inject something that could kill them and not offering them an alternative when we have an alternative.
Really, the key criteria that we use for determining somebody's eligibility is, are they using street fentanyl? And as a consequence of that, are they at risk for dying?
So originally people were getting four times a day, but with COVID we were able to respond by changing that from 4 times a day, accessing the machine to 1 time a day. So they're able to get their full day with that.
This program's great. Like, where do you see you can walk in, put your hand up to a machine and it distributes what you need, right? I mean, that's great.
I was one of the first persons through the program here, and in fact it's changed my whole life. Forming a great relationship with my grandchildren. I have an 18-year-old granddaughter that I've now been able to spend time with, and I'm not always running around looking to get well.
I used to have to wake up in the morning, do crime or something right away to make money. Right now, at least I just know I can come here. It takes away the stress. Kind of helped me stay out of jail, that's for sure.
And there's literally tens of thousands of people in the province who are putting themselves at risk by buying toxic street drugs. And so we need to come up with programs that can really expand beyond very structured medical models of giving people injectable heroin or injectable hydromorphone.
So we see up to 700 people a day at OPS. Getting a predictable dosage from MySafe for the folks that we see every day is saving their lives. We see lots of people overdosing every day. Once they get on this program, their life changes absolutely.
My personal experience dealing with pharmacists and having to be like moderated and told what to do is frustrating, and you feel like a little kid. And this puts it in your hands, how you want to deal with it, and limits the interaction and judgment that you would have to deal with going to a pharmacy.
How many people do you want to die before you decide that maybe hitting rock bottom isn't the best way for people to change? And it might seem counterintuitive to people, but giving them a safe supply of drugs is their first step towards reducing or not using, if that's what they want to do. And give them the opportunity to actually do that is, I feel, is the most important thing that I can do.
Hello, everybody. Hopefully I'm on after the video. I'm talking to you from outside my campsite, which is renewing my soul and getting some fresh mountain air. Ironically, after we've heard about the issues around Indigenous people in our province. I'm in Manning Park, and this guy apparently was some kind of horrible human being. So I think there's efforts to change the name of this park to its rightful owners. But anyways, I'm really happy that the technology allows me to be outside and still talk to you. Thanks for playing that video. It's kind of I'm trying to come up with solutions that will make things low barrier. And Andrea and actually all the speakers in the panel spoke to the fact that we really are just scratching the surface as far as people's access to a safer supply of drugs right now. And it's never going to be covered enough by a medical model of this. And when I present the idea that we give drugs out of a machine, especially to American audiences, it's just like I'm from outer space or something. There's just no way that could ever happen. And I try and point out to people, well, do you actually know what's happening now? Like, to think that somebody could go and get their medications from a from a machine with a regulated dose that is controlled and we can dispense as people need, versus buying from a stranger in an alley, of often somebody who's using drugs themselves. So I mean, this is to me just a really pragmatic, practical way to do it. Right now, since it's still in a pilot phase, it still requires a physician prescription. For the most part, I'm doing those prescriptions. So again, it's quite limited that way. But the pressure really needs to be on policymakers to have a criteria for people to get on a safe supply of drugs, and they just qualify. And the prescription is really unnecessary, and they'd be just part of a program that supplies drugs to them. This is, my background is in infectious diseases, but also public health, and we really have to view this as a poisoning epidemic. It's not anything to do with addiction. Safe supply is not trying to necessarily treat people's addiction, but as you can see from those few testimonies and my experience, that people getting up in the morning and having some place to go and access their drugs is life-changing in itself, and really gives people the opportunity to think about other things to do with their day rather than hustling for drugs. So it really is life-changing, and if people really want to work on their drug use and addiction, it gives them that opportunity to do that, which is really phenomenal and something people have never had before. I know that one of the themes, or the theme of this whole symposium, is around decriminalization, and clearly that's tied in very closely to safe supply. We, as a group, we push back hard on the idea of the war on drugs, and we have to end the war on drugs. But the opposite to ending the war on drugs isn't just ending the war on drugs. We need to think about how people who are using these substances access them, and that will require a regulated access and a regulated supply of these drugs, and we really need to focus on that too. So I think the safe supply and decriminalization and defunding the police are all go hand in hand of how we really make radical changes to our drug policy. And too often, many of us have been in these symposiums and panels and discussion groups for far too long, and we're really pushing and fighting for incremental changes. The story of Edmonton and the IOT program is, it's fantastic that people have fought back and were able to salvage it. But the Naomi program that pioneered this in Canada is almost 20 years old. I mean, it's crazy that we're still having these fights to salvage evidence-based programs. And I just want to make a comment with Andrea. I think we really do need to continue to provide evidence for these things, but we really need to push back on this ideology that really drives it. And I think injectable heroin program is a great example where there's amazing evidence, but that has not been enough to turn the dial. And we really need to educate and pressure people to make these changes that are so entrenched in our society. And I'm asked all the time about, what would you do if you could have a control of the overdose crisis? And really, it's a regulated, decriminalized drug supply for people, and to offer people the care and the treatment that they really need. And that's not necessarily current medical models, but so many people are battling with trauma and other issues in their lives that really need support. And we've continued just to drive people to the margins and not giving them the support we need, and put all our money into police and enforcement. And that really needs to change also. So I think what I'm trying to push hard from my position is really to have low barrier access to drugs. I think the technology like MySafe can help that quite a bit, or be a scalable model, but there's clearly other models out there. But basically, we have to allow people to use the drugs of their choice in places of their choice. And as long as they're using drugs that are known of quantity and potency, we could quickly have a major impact on the number of people needlessly dying right now from a toxic drug supply. Thank you.
Thank you so much, Mark, and everyone, for this really engaging conversation.